Hello and welcome to today's webinar, Beyond MTV, gbMSM Health in Edmonton, Kelowna, and Peel. That's beyond Montreal, Toronto, and Vancouver, gay, bisexual, and other men who have sex with men, health in Edmonton, Kelowna, and Peel. My name is Henry Wu. Though WebEx lists me as Darren Ho, I am a research investigator with CBRC, the Community-Based Research Center for Gay Men's Health, and I'll be your moderator today. To start, I would like to let our audience know that we are automatically muted for the presentation duration of the webinar, as there will be opportunities for questions afterwards. Feel free to enter questions into our chat box at any time, and our presenters will answer them after everyone has presented. And then you can also send a direct message to me, although I am listed as the host, Darren Ho. Today's webinar is a continuation of CBRC's webinar series, which delves into topics and issues pertaining to our community of gay, bisexual, and other men who have sex with men and beyond. CBRC has a number of programs, including gbMSM Health Network, but also the annual Gay Men's Health Summit and the periodic Sex Now survey, which will be launching soon this summer. For those of you who don't know, the gbMSM Health Network is dedicated to connecting people and organizations in BC who are working to better the health of gay, bisexual, and other men who have sex with men, including trans and two-spirit men. I would like to thank PHSA and the Provincial Health Services Authority for sponsoring this webinar series and making it possible for CBRC to continue to host knowledge exchange opportunities such as these ones. As well, I would like to thank our three presenters, Philip Banks, Brooke Biggin, and Kim Knacken, for joining us today to make this discussion possible. Today, we get to hear about the amazing programs, initiatives, and interventions that exist outside of major cities that often get the spotlight. In this webinar, we showcase the unique strategies and successes of other cities. Thus, we begin the spotlight on to work advancing the health of gay, bisexual, and queer men in Kelowna, Edmonton, and the Peel region. So to start, we would go from east to west and begin with Philip Banks. Philip Banks is currently the Executive Director at Peel HIV/AIDS Network, a health and community service organization serving Brampton, Kilden, and Mississauga in Ontario. Philip has been working in HIV cum gay by queer men's health for over 20 years with experience in urban, suburban, and rural environments. Some of his past work includes program and organization development for gay men's health at Gateway, Health Initiative for Men, and Gilbert Center Peel HIV Network, and Dialogi. Beginning in the late May, Philip will move to the role of director at Ontario's Gay Men's Sexual Health Alliance. Philip is a poly-Virgo rooster with a passion for French pastries. So without further ado, I would just like to pass off the presenting privileges to Philip Banks.
Okay, hi. I'm going to just spend a couple minutes talking a little bit about what we're doing here in Peel. And I've entitled this Suburban Gay Bar, Oh Yeah, They Don't Exist. So I want to touch a little bit on the context. Peel is a regional municipality. It's one of the larger regional municipalities in Canada, and it also contains two of Canada's top 10 largest cities. So Brampton is the 9th largest city in Canada, Mississauga is the 6th largest city, and then Caledon is a village slash small town with a large rural area. You can see just on the little map here that we're directly to the west of Toronto, starting down at Lake Ontario and then running 100 kilometers or so north. Just to give you a bit of a sense of the area, we're just over 1,200 square kilometers, and the city of Toronto is just about 630 square kilometers. So we're almost double the size of Toronto in terms of geography. The population is 1.38 million. The population of Toronto is 2.73 million. So we're close to Toronto, but we're not close enough for LGBTQ folks, or gay, bisexual, queer men, and other men who have sex with men, to easily access services in Toronto. And I talk about services, but I also mean the social cultural activities that are available in Toronto. And then the region is also very culturally, linguistically, and religiously diverse. So some more of the context is that in terms of the visibility of, say, a gay community like what we may know in cities like Toronto, Vancouver, Montreal, and other cities around the country, we have very low visibility. And so a lot of what we talk about is 2S LGBTQ plus community. So in the region, there is no 2S LGBTQ plus specific community center or agency. We're the closest that you get to that. There are very few community-specific programs or services, and they're not very widely publicized. We have no gay bar, we have no gay cafe, we have no gay sports groups, we have no gay clinics. You know, the list could go on. And this isn't a complaint. I'm setting the context. But what is a complaint, I think, is based on what we hear from community, and that's both, you know, anecdotally and through some focus groups we've done. Community doesn't feel seen, they don't feel heard, they don't feel considered out here in this region. So there is the context of the suburbs, I think, is for those that are familiar, this may, you know, you may understand this, you know, quite easily. But for those who have never lived or worked in the suburbs, they're a very unique kind of community. Okay, let me see. I'm trying to. Okay. So the organization I work for is a traditional HIV organization. So probably most people on the call can, if not all, can relate to what that looks like. And more recently, we've been shifting to broader health and community services. We're the only organization of our kind in the region. And just to give a little bit of comparison, so there's one of us here, and in Toronto, we have probably closer to between 12 and 20 funded agencies and programs around HIV and some of the work that we do. We have a range of services: harm reduction, sex work programming, work with African, Caribbean, Black communities, PHA or PWA programs for people living with HIV, and then 2S LGBTQ plus communities. We have a staff team of 18, and our queer work has grown over the last 4 years from a staff of 1, focused very specifically on gay, bi, queer, MSM work, to a team of 4 now working on 2S LGBTQ plus issues. I would say that we are now the leading 2S LGBTQ plus organization in Peel, and that we're champions and advocates for the community. So our approach. I want to talk briefly about our approach because one of the things I think that we have, we've looked at the context, we've listened to the community, and we've listened to the folks we worked with, and I think that there's something covering my notes. We take an approach that understands the unique needs of gay, bi, queer men, as well as the common factors influencing broader 2S LGBTQ plus health. So that means that, in the context of our work, our work has been heavily focused on HIV and sexual health promotion for gay, bi, queer men for really as long as we've had funding to do that kind of work. But we recognize that, in the suburbs, heterosexism, homophobia have a huge impact on the lived experience of gay, bi, queer men, but also the broader 2S LGBTQ plus community. We see the impact of hegemonic or binary applications or understandings of gender and how they impact on health, safety, as well as, social, cultural attitudes in the region. And then we see that for the broader 2S LGBTQ plus community, like the gay, bi, queer community, there's a lack of visibility, lack of space, lack of policy, lack of awareness and education. So that really influences our understanding of the work. Our work is also, I think, about fostering allyship among 2S LGBTQ plus communities. So, we have a large population. We don't have like a critical mass. So there is no real visible queer community or 2S LGBTQ plus community. There's really there's no visible gay men's community. And to some degree, that's I think, again, a bit of a suburban, the way that these suburbs have evolved. So, like referring back to the sort of the small town gay bar, I think where community does exist or where small networks exist, they may be more integrated, meaning that the gay boy has a best friend lesbian who they hang out together with, and they build their community around that. So it's not necessarily so segregated based on gender or sexual orientation or identity. We also recognize that fostering allyship is just a practical approach. So it helps to build a broader, a stronger case for policy and support and funding support. And it helps us to synchronize our efforts where there are common needs or interests. And I think another important piece that's really, I think, more political is that, our team here really believes in leveraging the power and privilege that we have in this particular context. So we are probably, in terms of queer work in the region, we're probably the best funded, and I'm not saying that there's lots of great funding, but we're probably the best funded. And our funding has, like so many in the HIV sector, though obviously, again, not adequate, has been focused on HIV and gay bi queer men. And so it's about leveraging some of those resources to benefit the broader 2S LGBTQ+ community. And the other piece is really just the leveraging the power and privilege of sort of what we may see as the resources or the privilege of say, cis gay men who are often seen as the face of a gay community. We want to challenge that narrative and expand that narrative to make sure that when people think about gay men, especially in the suburbs, they're not just thinking of like the gay white cis man that lives in the city. It's somebody else. It's the other. We want them to think of the queer community as diverse, as intersectional, and then we need to make the work relevant to the system or the systems around us. And so there's a stronger argument to invest in our work if there is a critical mass. So a brief example. We have an intervention developed by the Gay Men's Sexual Health Alliance, and it's focused on gay men and mental health. So when we took that around to organizations around the region and we said, we want to be able to come in, we want to do some work with you around gay men and mental health, they said, well, we don't see that many gay men. So it's not really worth our time to invest in sending staff to this training, to focusing on a population that we don't see a lot of. Well, we may see a spectrum of folks. So, say trans women, we may see lesbians, we may see, trans kids, and we may see some gay men. So that's more relevant to us. It also helps us by taking a broader approach to create opportunity to introduce gay bi queer men's needs and issues into the dialogue when we're seen as part of a broader community. Okay, so now I'm going to get to sort of some of what we're doing. So I guess I want to acknowledge that in this area, there have been fits and starts over the years. Oh, sorry. Hi. So I want to acknowledge that over the years, there's been sort of fits and starts in terms of community organizing, but not a lot of commitment from organizations to do that work on a sustained basis. So one of the things we did is we acknowledged that for our teensy little organization here in Peel to have any impact, we needed to actually have allies. So we spent about a year and a half knocking on the doors of organizations around the region that had indicated through programming or through something that they might have said at a meeting some interest in the LGBTQ community. And we put together a collaborative of 9 organizations that's funded by the municipal government. And it's really looking at increasing organizational capacity of each of the member organizations to better work with LGBTQ communities. And it's also to have a leadership table in the region that's advocating for 2S LGBTQ communities. So some of that work is around sharing common needs, issues, interests around inclusion in our organizations. And we have a position that's funded specifically to do training and capacity building with those organizational members. So starting with organizational audits, surveys of staff, developing a report about what LGBTQ or 2S LGBTQ+ inclusion looks like in their organization, developing a plan of action to start to address either barriers or opportunities in the organization to enhance inclusion. And then a big part of that is listening to the community voice. So ongoing community consultations where we hear from the community about what their needs are and then use that to filter back to the organizations so that they can understand the stories of the community and how those stories fit in with their organizations. Another big piece is around advocacy is our International Day Against Homophobia, Transphobia, and Biphobia. So we call it We Belong. And it's called We Belong because what we heard from so many queer folks in the region is they don't feel seen, I said that, but they also don't feel like people think that they belong. So a common story is, you know, you go to a doctor, you go to a counselor, you go to a social service agency and you say, I'm queer, I'm gay, I need this, and people will say, oh, well, there's the 519 in Toronto, you should go there. And so what we were trying to do is to create a profile for the 2S LGBTQ communities in the region that says we're here and we belong. And so we need you to recognize us. I mean, it's not a plaintiff kind of request. It's really an assertion. It's a statement that sort of starts to draw, you know, I'm using finger quotes, but in some ways the battle lines of you know, making sure that 2S LGBTQ plus communities are on the agenda. Some of the programming we do with the community is familiar probably to many people. So Totally Outright, we've run that a couple times, and that's a leadership, sexual health leadership program for young gay, bi, queer men, trans and cisgender men, and we've had success with that. We've actually got staff members now hired who are working with us that have participated in that program, and that's where we were able to identify talent to build the team. And then Gender Journeys, which is a program for folks exploring gender, and that is all gender identities or expressions, and at any point in any personal journey there. So these are interventions that are focused on providing knowledge, skills around sexual health and other issues important to those communities, but it's also, most importantly, it's a space for people to come together and to meet others. And that has been really one of the greatest benefits and impacts of that. Again, given the very low profile of community and the absence of public spaces. Other activities that are really common, online outreach, which is huge because we have no spaces to go to. We can't go to bars, we can't go to cafes, we can't go to bathhouses to find community. So a lot of our work has to happen online. So social media, online outreach, and those tools are really important. So we're just in the process of building a site called Rainbow Salad, a virtual hub for 2S LGBTQ plus communities in the region to be able to, again, raise the profile, but also create a space where folks can identify and access information about services that are relevant to queer communities. We have a big presence in Pride community, Pride activities across Peel. And then we worked on this really interesting and innovative program called Pride and Volunteering, which is specifically focused on inclusion in the volunteer sector and in the volunteer base in organizations. So a lot of work has been done with, no, I say a lot. That was actually, it's not entirely true. I think when we talk about inclusion in organizations in the not-for-profit sector, we're often talking about making sure the services are inclusive to clients, or we're talking about making sure that the space is safe for staff. But we don't often talk about this rich resource of volunteers and what that means and the opportunities that are there for organizations around LGBT inclusion if they are attracting LGBTQ, 2S LGBTQ plus volunteers, but also the impact to their ability to actually have a good relationship with the community if 2S LGBTQ plus volunteers are having a bad experience. And then a little bit more work in progress is through partnerships, and many of these are through partnerships. We don't have the resourcing and the scope to do this work alone, so we really leverage partnerships. And most of the partnerships are or organizations that don't do currently LGBTQ work, so we're really introducing that work to them. And so the 2S LGBTQ plus refugee and newcomer drop-in program, there's a very, very large influx of newcomers and refugees into the Peel region. So within the GTA, we get the majority of newcomers to the Greater Toronto area. And then we are just waiting to hear back on a grant for a Two-Spirit education and outreach position to join the team. Some of the images on the side are images we use in our promotion for our programs. And I guess the takeaway I want to leave you with is that from my perspective, the suburbs are unique. they were built to house people and often away from urban issues. So the fact that Mississauga, its population is 700,000 plus, and Brampton is 600,000 plus, and they sort of smell a bit like cities in terms of what's going on, but they're slow to acknowledge that they're cities, and they're slow to acknowledge that the urban issues that I think many people come to the suburbs to get away from, that they actually exist here. And I think that to some degree, queer identities and non-binary gender identities or trans identities are not seen as, are seen as urban issues and therefore not here. And definitely the suburbs were not built with gay bars in mind. And then the other thing I want to say is that at this point in time and in this place, our gay, bi, queer, MSM health promotion work needs to take place within a broader 2S LGBTQ+ health promotion framework. And the benefits of that, I think, go both ways. So the broader 2S LGBTQ+ communities benefit from that work, and we can't do gay, bi, queer men's work, I think, effectively without including or taking a broader approach. And then I think there's something we can learn from the work in the suburbs and smaller urban environments about how gay, bi, queer, MSM health may or should be also considered within the broader 2S LGBTQ+ context or framework. I just want to say thank you to CBRC for this opportunity. I want to say thank you to all of you for joining in. And I want to thank the team here at FAN that are working on 2S LGBTQ+ needs and interests. So Yoshi, Ziva, Gavin, Matt, and Steve. And then there's just a little photo of the staff here at our We Belong event. All right, that's me. Thanks.
Awesome. Thank you, Philip. So right now I'm just going to switch the screen over to Brooke. So Brooke Biggin has worked in the HIV, LGBTQ health sectors of Alberta for several years and is based in Edmonton. Currently, Brooke works as the Prairie Regional Manager with the CBRC and is co-chair of Alberta's Provincial ST-BBI Operational Strategy and Action Plan. As a community organizer, he has founded the Edmonton Men's Health Collective, a grassroots health organization run by and for GBTQ men, which aims to create equitable opportunity for queer men to experience positive health and well-being. So, Brooke, you can take it away.
Perfect. Excellent. Thanks, everybody, for joining the call today. Although I work for the CBRC today, I'm going to be speaking on behalf of the EMHC because we love our four-letter acronyms in Queer Men's Health. And so that's the Edmonton Men's Health Collective. So a little bit on the history, because I think the history of how we came about is important and is really interwoven throughout the work that we do. Just about 3.5 years ago, I got my first gig in LGBTQ health or the HIV sector working for an ASO. And it was just really surprising to me that our community faced all of these various health disparities. And of course, in a place like Edmonton, there weren't any LGBTQ or GBTQ or queer men's health organizations specifically serving the populations. And it appeared, at least at the time, as though there was limited community engagement with AIDS service organizations who had kind of inherited this queer men's health work through the lens of HIV. And so there's a big question of, well, what can we do about it? And so being a little younger and more naive at the time, I thought, well, let's just try to do something. And so really, those initial first steps were informed by a few different key figures and things in life. And so one, of course, is ACT UP in the early days of grassroots AIDS activism as a young queer guy living with HIV. That had always inspired me. And so I thought that perhaps, although we didn't necessarily have access to institutions or queer men's health organizations, that maybe we as a community could organize and do something. I was also inspired by Michael Fair, who was the first openly gay elected politician in Alberta, who started HIV Edmonton, back then the AIDS Network of Edmonton, around a kitchen table. And so that was always an exciting idea to me. And so, of course, it wasn't a kitchen table, but it was a living room. And essentially, I just got a few guys from the community who were interested in doing something about the health disparities facing the population. And we just got together in the living room over a few beer and hatched what is now known as the Edmonton Men's Health Collective. And so looking at the core of who we are and what kind of came out of some of those initial discussions is really that our aim was that all queer men or queer masculine folk at least have the equitable opportunity to experience positive health and well-being, and that really the areas that we would focus on in helping to achieve that vision would be community education, capacity building and support, doing provider training, so with healthcare professionals and service providers, and community-based research. Additionally, there were some very significant underpinnings to the organization as well. So just as important to us as what we're trying to achieve and how we're achieving it are really the values that underpin that. And so you'll see there are a few of those there that aren't too surprising for a grassroots movement. So this idea of nothing about us without us, the idea of true representation, and that we are community accountable. So especially at the time, we didn't have any money, so we weren't accountable to a funder. It was really the community that gave us the right to exist and were that stamp of approval. But early on, we recognized that it was important to take a comprehensive approach because a lot of the work that we were seeing being done around queer men's health was tied to HIV and STIs. And although we recognized that was important, when we put out a community kind of needs survey initially asking members what topics were important to them, we actually found things like body image and challenges in relationships and whatnot were more people were studying those as issues they were most concerned about than HIV and STI. So we wanted to take a comprehensive approach to health. So we essentially set up 4 different health teams, so a team of sexual health, physical health, social health, and mental health, in addition to a community-based research team. And so I'll just, over the next couple minutes, give a very brief overview of some of the things we've been up to over the last, we've only been launched for just over 2 years publicly, but it's been about 3 years since that first meeting in a living room. And so when we look at the area of sexual health, we've done a lot of online campaigns. Now, when I say campaigns, they're relatively small in scale, and nothing I'm here to talk about today have we had a budget of more than $1,500. So it's all definitely on the cheap. But we've done campaigns like our Difficult Questions campaign, which really got guys thinking about some of the nuances to HIV and STI prevention and really understanding what are actually those important questions that you want to ask yourself in advance of sexual encounters or your partners during, and some things you might be prepared for after the fact. We're currently working on a Party with Guardians campaign just because the Alberta government recently increased the age limit for men who have sex with men and trans women around accessing publicly covered HPV vaccinations. And so we're putting that together with a little shout out to Cardi B. PrEP Alberta, so you'll see there's a bit of a screenshot on the page. So the access situation here, we were recognizing that lots of people were having challenges accessing PrEP, and so we ran a couple community surveys. And so what we call community-based research, of course, not up to the same standards necessarily as some of the work that the CBRC and other groups are doing, but there's not really a research infrastructure here that's attached to the queer men's health sector because there's not really much of a queer men's health sector. So we just do what we can with what we can. But between those 2 surveys, we've had over 530 responses, I believe, and we put together different PrEP reports that now sit on our PrEP site, which contains both a provider portal and a patient portal for helping them navigate the PrEP access pathway here in Alberta. And of course, we've been engaged directly with the provincial STBBI strategy and action plan. So currently our members sit on various different groups that are looking at potential innovative projects around screening. I also sit as the co-chair on the steering committee on behalf of the CBRC and the Edmonton Men's Health Collective. In the area of mental health, initially we offered mental health first aid to the community because we recognized there were lots of challenges to accessing those services. And so we thought, well, what if more people in the community just have some additional mental health first aid capacity so that maybe over time just more and more members were equipped so that there was a greater likelihood that if you needed to reach out to somebody in your community, they'd have the capacity to help you. We've done some work around eating disorders, so you'll see that is one of the posters that we use for one of our events. We did a body talk video series where we got local queer guys from the community, specifically wanting to highlight experiences of trans and non-binary folks, folks who don't fit that stereotypical beauty type. We released a 3-part series there along with some blogs online. And recently, because we're finally able to qualify for some of these grants, we received a small grant from Alberta Health to do an LGBTQ opioid awareness project, which includes community naloxone training, social media campaign, community consultations, and a 1-day LGBTQ harm reduction forum. Around physical health, we actually also recently received funding to do some work from the Alberta government around LGBTQ fitness accessibility, so specifically focusing on trans and non-binary folks. And within that project, we'll be doing some formative research to better understand the current needs and experiences of community members and fitness professionals that are less acquainted with the LGBTQ community. We'll be developing and delivering some resources and actually working with fitness facilities to assess their accessibility and providing them support in improving LGBTQ accessibility. And then finally, in the area of social health, so one of the first things we really did when we grew as an organization, or was, the small grassroots ragtag group, was apply for one of the Resist Stigma grants, which is a program that the CBRC did a couple years ago, and we used those funds to develop a video that had various guys from the community talking about experiences of stigma, so things like sexualized racism, and it got, I believe, at least over 21,000 views from just one from Facebook alone, and then I think greater through other formats, and so that was a really great experience. And then just over the next year, our plan is to really look internally, and so we're trying to do a better job of being accessible to different groups within the community. So we're working with deaf and hard of hearing queer communities around ensuring that our programming and education and whatnot is accessible, and also hope over the next year to do an accessibility audit to just get a better idea of how we're doing in terms of accessibility for queer and trans people of color and Indigenous populations. And then, of course, we do a variety of general programming as well, that you'll see some of this stuff happens where you are, running totally outright. So we've just done it for our 3rd year. We're engaging the current iteration of Sex Now around some of the data collection here at Edmonton Pride. We always send a few guys off to the Gay Men's Health Summit so that they can have a presence at that national discussion, doing work around provider competency and whatnot. In terms of what's on the horizon for us, we hope to increase community capacity building. So we currently have a grant in that will ideally help us do more community capacity building in the area of community-based research. We'd really love to potentially expand the investigators program here soon, actually training community members up in program design, implementation, and evaluation, potentially expanding some clinical services at some point in terms of STBBI testing and mental health support, and hopefully getting some organizational sustainability. This is a 100% volunteer-powered organization. We have no staff at all. I'd like to have a couple staff so I don't go crazy someday. And then it'll be a really interesting conversation about how we balance our grassroots with institutional infrastructure. And so the big takeaways for me are really, you can do a lot with a little. Like I said, nothing that I just talked about have we done with more than $1,500. And so I think sometimes when we have more of that institutional infrastructure built in, we think we need a lot to make things happen, but you can do a lot with a little. Sometimes less is more, Sometimes we look at areas that are smaller urban communities or outside of that MTV area, thinking about all the gaps that exist. But, I always like to come late to a party because the prep work is done. And so the fact that we're starting a little bit fresher and newer in some of these areas actually allows us to learn from the successes and some of the challenges that have been faced elsewhere, and to really kind of carve our own path forward. And then lastly, community is capable. Neither myself or any of the people who were involved with the EMHC had a lot of experience in the nonprofit sector, in the LGBTQ health sector. We were just a group of community members who decided they wanted to do something and kind of learn as we go. And so I encourage all organizations to really not look at community as, from a deficit-based lens, and not looking at them as, can they volunteer at our booth or do that? But, community can create a whole organization like we've seen in this case. And so they're really our greatest assets. But that's it. I will close that down. Darren, you can take it away.
Okay, great. Thank you, Kim. Thank you, Brooke. I'll be transferring over the presenting privileges over to Kim now. All right. So Kim Kinakin is a longtime professional in the music, arts, and nonprofit sectors. He is currently the coordinator of the Men's Health Initiative in Kelowna, a partnership of the Living Positive Resource Center and Community-Based Research Center for Gay Men's Health. He has decades of experience working with HIV/AIDS community organizations and programs. Through MHI, he has been able to address STI testing needs within Interior BC by building partnerships with nurses, nonprofits, local media outlets, and learning institutions, local businesses, and community groups through PrEC testing events aimed at gay, bisexual, and other guys who like guys in the region. So you can take it away, Kim.
Thank you. It's great to be the last person presenting on this panel because, as Brooke said about coming late to the party, a lot of the prep work is done, a lot of the conversation has already been set up for what I'll be presenting today and some of the challenges. First, just want to acknowledge that the focus of this project for me will be on Kelowna, BC, and that is on the traditional unceded territories of the Syilx people, but the work of MHI program extends beyond that region as well with other First Nations communities. I will be presenting for the Men's Health Initiative, and that is a partnership right now with Living Positive Resource Center in Kelowna, BC, as well now with the CBRC out of Vancouver. To give you an idea of the Interior Health region, MHI mirrors the Interior Health Authority's region for services. That's where the original funding mirrored. So when I came into this program, it was looking at the second largest health authority in BC, which is a very geographically challenged place. And what I mean by that is very mountainous. It is very hard for people to travel into winter, and for a person to actually look at connecting with the community, a mandate for MSM throughout the interior region, it was a bit daunting. As you can see, the population density per square kilometer in the interior is 3, and if you compare that to the Vancouver coastal region, which you know, has a density of 20 in the whole health authority, which is actually quite rural. If you look at Vancouver specific, which is my comparison city of the MTV, their density is 5,400. So, you know, looking at the challenges of urban compared to rural settings, it is very, very different. And Kelowna, in theory, just over 100,000 people is now considered urban, but historically would be considered rural. The area that we have also has 54 First Nations communities, as well as Métis communities throughout it. And there are 3 kind of sections corned off in the Health Authority: Interior Health West, Interior Health Central, and Interior Health East. MHI has been located in the Kelowna, in the central Okanagan, which would be considered the central area. If I were to look at this program as we'll look at focusing on Kelowna, I definitely see a need for there to actually be a person who can physically be closer to the other communities in the east and in the west. Currently, we now have a part-time person in the Kootenays, which is a new, great partnership through CBRC and Anchors. And I hope one day we'll have someone in the Kamloops to focus on the Interior Health West. And to also further reach out to the First Nations community in those areas. There are strong First Nations communities and services throughout the interior region, but Interior Health West definitely has the largest percentage, and there'd be a lot of great work that we could do there. I shared this map to people when they're talking about, well, you know, how different is it from an urban area to a rural area? And it's like, okay, here's a cell phone chart of coverage in the region of BC. And you can see that while, there is touchy mouse, while it's very dense in the Vancouver region, as you start getting out into the rural areas, there just isn't cell phone coverage. There's so many mountains. The geographical challenges don't just make it hard for people to travel, it makes communications hard. And while people are connected on their phones, let's say in Kelowna, once you leave that area, you're not connected. So when I focus on the program, and it's not just Kelowna, I'm having to look at that whole perspective of how do people travel to get their services, where do they go, and what limitations do we have. If I just focus on social media, I'm missing also the people who aren't connected or aren't able to do that. I came into this program and looking at what was the history of this program, so that I had a kind of a baseline to where to start off of. Originally, I'm from Vancouver, so moving out into the interior was a really big shock for me to see some of the disparities of health services. And when I came into this position, I also was able to see that some of the research had been done to, in 2008, just assess that doctors out here said, we don't really have any gay or bisexual patients out in this area. And when we actually surveyed the gay BiMSM folks that was connected to the organization, they were like, they don't feel comfortable being out to their healthcare provider because they don't know how knowledgeable they are or sensitive they are to their sexual and gender identities. So in 2012, they were able to use that research to apply for a grant, and in 2012 started the Men's Health Initiative. And I had operated for 5 years through PHAC funding, and currently we now have some provincial funding. And when I came in, I looked at some of the research of what was already done. At one point, there was only 6 months of funding left, and we didn't know if we'd have any more funding. So I was like, what can I do for this program to be able to have some legacy to whoever would inherit it later on if funding ever came. Of course, the funding continued, and I'm still here. But so we rebranded it, looked at sorry, my mouse is so sensitive, looked at the program, created a new logo, and looked at some of the reporting from one of our events called the Gathering to actually talk to the guys from throughout the interior. We brought them together. A lot of our money is spent on travel to bring people together, or for the position of myself to go out to them. And what we found out was that the 6 priorities that they identified themselves were around education, testing, safer spaces, and fun, which actually was just fun, but folks recognized when they were looking through that there just was no safer spaces to actually do the fun. There is no brick and mortar places throughout the interior that are LGBT rainbow community associated at all. Prevention and harm reduction was another need, outreach, and research. So from that, we created some needs of what were some of the committees that we needed for MHI. The advisory committee had already existed, and then we looked at maintaining that and making sure there was representation throughout the different regions of the interior health region, so we have voices represented as we move forward. The art and design committee was about communications. That's a background of mine and some of the other volunteers, as well as communication and outreach at events and research and advocacy. We're lucky enough in Kelowna to have a UBCO, University of UBC, that has a lot of research folks to volunteer for our organization, and as well as just having some social events and fun. We branded MHI as Guys Who Like Guys. We felt that there was a lot of alienation of just being seen originally as a gay men's health organization. And included in our description of who we provide service is to folks who identify under the rainbows of sexual and gender minorities, but really the language that people used wasn't men who have sex with men, or a lot of the ideas just a guy. And so we use Guys Who Like Guys, and know that that's not inclusive words for everyone, but is what we're open to. Some of the events that we put on, we have social events that we try to put out with folks in the different regions, and if we can, we try to repurpose them. So if there's a possibility of doing a fruit float in one place, like Penticton, we did one, it was easy actually for us to do a similar event like that in Nelson a few months later. Once a year, we have the budget to actually be fortunate enough to have the budget to bring folks together throughout the interior, and we have an event that is now called the Gathering. And that provides an opportunity for folks to actually see what is going on in the interior as a whole, but to actually connect, sometimes for the first time in a safe space with other guys to actually talk about these issues. And it's a really empowering to not just be going to a conference that's talking about what's going on in the city, like a lot of the services are. We're really focusing on what are challenges in the interior, and they really recognize and feel that their voice is being heard and their needs are being addressed, or at least heard and seen. And one of the big catches that we mentioned earlier of the needs that we found success with was a testing event that we called PRIC. And so when I started, they'd already done one event and it seemed to be a success. So I was like, let's recreate this and roll it out and continue it on a regular basis. And that has really been the big success of this project, because there was such a need. Many of the folks, as I said that they don't see gay men in the interior. And what's interesting about that is the stats actually justify that 50% of MSM identified as gay in interior health, and in the Sex Now survey, of all the health authorities, that was the lowest number of people who identified as gay, while we had the highest number that identified as bi. And so I do think it just shows that there's like a different identity in the rural area of how people identify. And we also noticed that we were the second largest health authority in folks who were not out to their healthcare provider. And the stats from the Sex Now survey also mentioned that folks who aren't out to their healthcare provider are 10 times less likely to have HIV tests. So it was like, okay, HIV testing and STI testing is very important in our region. So some of the history of our region is that many of the folks, the two-spirit history, the colonization and residential schools really erased a lot of that First Nations history and is being recreated and being slowly shared, but that's not necessarily what the history of these folks in the community grew up with. And so that's still very new, and gay history is very new here, because traditionally folks who were not First Nations, let's say, would actually go to the city to get their needs met or move to the city to be a part of the gay community there. And the folks that were historically in the smaller towns out here were the folks that were maybe either fit in or were just quieter about it and didn't talk about it. So there's not the gay bars, as Philip had mentioned. There's no gay spaces. There's no brick and mortar places for people to go. But we do have now 2 universities, multiple college chains, and we have a lot of youth coming in from other areas who want to see the services that they're used to in the big cities. So there is a change in that happening, as well as emerging tech jobs, where traditionally it's a blue-collar labor market with mining, transport, and forestry, with the seasonal summer flux of folks coming in for the tourism and agriculture. And there's a large aging population of snowbirds in our region for people who want to retire. And again, a lot of the youth that grow up here leave. So when we looked at BC as statistics, and we saw that 51% of MSM were HIV diagnoses, we looked at that further to see the interior health that, this is way too touchy, there was 35%. And so a lot of the services at our AIDS service organization were actually focused around injection drug use and access for that community. Yet services around MSM didn't really exist at the AIDS service organizations elsewhere in the region. I would go to these organizations and say, where's your MSM program? And there really wasn't one. It was let's go to a Pride event. And that was the limit of outreach to them. So we saw a real need. And when we looked at the provincial health report on HIV testing in the interior, I was really shocked to learn that in the city of Vancouver, there was a 7% chance that folks who were being diagnosed with HIV were also being diagnosed with advanced stages of HIV. And when you moved outside of Vancouver and you went into the Fraser or Vancouver Island, it almost doubled, or definitely doubled in the Fraser, and it was 5 times as large in the interior and northern health. So that means like basically 1 out of every 3 HIV tests was a person who was being diagnosed with advanced HIV at the same time. So I was shocked about these stats. I was also shocked to learn that our interior health region had actually closed down STI testing services as a program, as a project in 2012, exactly when the MHI program started. So why was this need for people wanting to have STI testing for MSM? It's because there was no place. And when I really look at other cities, it's just taken for granted in other health jurisdictions that there is an STI testing clinics that are available. That service does not exist at all in the interior health region since 2012, and makes it really hard for us to provide services. We do have a Stop HIV program, which provides HIV testing, but that was meant to be added to STI testing services, and as we didn't have them, there was no place to add them. So they're burdened with STI testing as well as HIV, and they don't get the funding for that. So the win, of course, was doing STI testing. And out of all this research, we also created a petition with a bunch of our other community groups to raise awareness about the need for STI testing in the region, and created collectively the Interior Sexual Health Initiative, which has an online platform, and at events we collect signatures. But focusing on PRIC, the success I was talking about, it is actually a partnership with Interior Health, through the Stop HIV program and Options for Sexual Health, which was previously known as Planned Parenthood, who have a bunch of clinics in different regions of the interior. And so basically, we provide the marketing and volunteers to be the sort of guys, greet the guys at the events. Interior Health provide the nurses, and the volunteers for some of the background stuff is provided by Opt, as Opt uses the space for Interior Health for their Opt clinic nights, which happen twice a week. And once a month, we tried the PREC event, specifically targeting guys who like guys, but it's also an open clinic for other folks to come in as well. We just basically guy up the clinic space for one night of the month. And that was something that we really recognized, was that clinic spaces were clinical. They were very targeted towards the heteronormative family of a mother and child getting their health care provided, and that the mother would therefore take care of the boys in her family or her husband. And there really wasn't a guy presence. And so we basically put up posters to make this place feel like a safer space and have messaging that's targeting our community. We make sure there's magazines in the waiting room, a rainbow sticker, condom packs, etc. So basically, I just have some photos here showing you how our clinic looks like with some of our volunteers who greet folks, as well as that we have different events that we change the colors up of our posters and just really try to show sort of diversity of our events. One of the things we do is actually get posters up physically in some of our community sponsors. I would actually talk to our local Kelowna Pride group, and they didn't even have a list really of businesses that were rainbow friendly for us to put posters. So we basically created a list to be able to look at who are these businesses and create those relationships and share their support on our social media pages. And that's what it was. There's a lot of marketing on our side of cross promotions. We rebranded our website. We have our social media, Facebook and Twitter pages. We have a direct email newsletter where we collect emails from guys so we can actually get emails to them regularly, because some weren't on Facebook or they weren't regularly on Facebook. They like to have you on email. We connected with some online partners to share some of our promotions. We made posters. We got a small grant to be able to print up the posters, as well as we made sure we put our partners and sponsors' logos on our posters so that they got recognition and actually could see what the community looked like. And I really think that that is a form of activism, much like Folk was mentioning earlier, of actually reaching out and putting a queer bent on a public space. We also did some stuff on Squirt. Castanet was a local advertisement or classifieds, as well as a Basanti who puts LCD screens in different stores, and we connected with them and we make the promotions for them and send it to them so they can share it. Building the partnerships, one of the quotes I was saying of Take It Homes was just, help sew the community threads into a stronger collective fabric. It was really amazing to see that folks that have been working in isolation and silos had never seen a collective partnership event happen. And so when we have our posters at the bottom, I make sure that the logos at the bottom here are all displayed for that community. And people are like, that's the community services that they can reach out to and that support them. And that we kind of not just give thanks to those organizations, but we kind of really present how big the community looks. And print posters, while social media is really great and it's free and it gets out there, we also noticed that actually taking physical space and putting up posters was political, but also it broke down the walls of isolation and shame and stigma for those who may not be connected with the community, but were able to walk around and actually see something about health services that were provided for them and communicated equality, diversity, and inclusion. And that for folks who aren't on Facebook and connected with the folks in the, online, that was an opportunity to say, okay, wait a second, maybe this community is a lot more open than I had thought. We collect facts and surveys at each of our testing events, and so we're actually able to have some stats. And this really helps us in our communications with Interior Health to prove that we actually have impact and who we're reaching. It's probably one of the most valuable tools that we collect. Opt without PREC, there we go. Opt without PREC in the beginning, they would maybe see around 3 guys at a regular testing event. When we started doing our testing events, we saw numbers from 200 to 500% increases of guys who were showing up for prick events. So we really proved the success of our project by reaching out with targeted marketing and actually marketing for the community, for and by them. We noticed that we not only reached out to MSM, that we also captured heterosexual guys who were like, there's just no testing options for guys to go to. So we know there's not just a need for the MSM to get tested, just for guys in general to get tested, and they felt that this was a safer space for them to get tested. And we sometimes had to turn people away because we were just limited by how many tests we could do that night. So there's definitely was a need. I also compared the outreach traditionally had been done doing testing at Pride events once a year. So I did a little cross comparison of how many hours it took in the blue to actually put on an event for the nurses and how many tests they got to our prick events, which actually took less hours for the nurses to do, but we actually had more tests provided. So that going just to Pride events and doing testing, while nice and possibly token, having a regular testing event was much more successful, and people wanted to know that there was going to be another one. So while we have challenges with Interior Health limited funds to do testing, and we obviously have that testing, or a petition to promote more testing options out there, we also know that our options for sexual health, while we can provide them at them, they don't exist everywhere in the interior, and they have capped their funding and will not get any more funding to grow. So we do have challenges with expanding the program. We have expanded the program, by the way, into Penticton, into Kamloops, as well as we're trying Vernon and hoping soon to do in Nelson. And each community has different challenges depending on what partners we have and what limited funding the Interior Health nurses have in that region. But we know that through our presentations, Interior Health is committed to continuing in the Kelowna region, and we're hoping to use those results to be able to continue and expand that program in other areas like the ones I just mentioned. And we're really hoping that our prick testing events become an opportunity to share other information and dialogues around PrEP and PEP, as that information is being presented as available to our community now in BC as of January. But we definitely need more partnerships to increase, to be able to do the prick events elsewhere. But we really see that it could be a very big win as long as we get the support and hopefully extra funding to actually have folks in each of those communities be able to do that. That was very long-winded, and that was me. Thank you.
Great, thanks, Kim. I would like to thank our presenters today, Philip, Brooke, and Kim, for their excellent presentations. All right. If anyone has any questions, feel free to type them into the chat box. Unfortunately, we only have time for a couple questions. So if you have a question for a specific presenter, you can send them directly via their email addresses listed here. I will leave the WebEx platform open for about 5 minutes to allow everyone the opportunity to get their questions in. In the event that we don't have the opportunity to get to your questions today, please copy down the presenters' email addresses so that we can send them your question, or so that you can send them your questions directly. So we do have a question here right now today. This is from one of our listeners, and they write, wow, such a great panel. 3 pioneers who are making their communities better for gay and bi men. Gentlemen, could you share one piece of advice for those who may want to start their own initiatives? And for our presenters, if you could just unmute yourselves and speak to that.
Yeah, so it's just Brooke here. I don't really have one piece of advice. I think there are lots of learnings to pass on, and I know that's something at the EMHC that we're willing to support. And so instead of giving you one piece of advice, I'd just say, you know, anybody who wants to can feel free to connect via the email that's listed, and I'm willing to kind of walk through some of those things for sure.
I just wanted to add, one of the pieces of advice that Philip gave me when I talked to him 1.5 years ago starting this project that he gave to me was find the need in your community and create the win around what is the need in your community, because every community is going to be different, and listen to what that community's needs are and work around with those voices. That's what's worked really well for me. But it's always changing, and there's lots of diverse communities. So there's a lot of growth potential, and I try not to I can't do every goal, but finding one win and focusing on it.
And Philip, do you have any comments that you want to make? Okay. In that case, once again, I would just like to thank everyone today for joining us and for our presenters for presenting today. I hope that everyone has a great rest of the afternoon or day or wherever we're calling in from.
Thank you for hosting.